So our presentation is about novelty technology in cancer. So what novelty technology is new technologies in an emerging field. And it has to do with some sort of device that seems far-fetched, which could be like precision medicine, which is the process of diagnosing and treating illnesses based on individuals' genetic makeup, or cloud computing, where doctors keep all the medical records and imaging in the cloud so doctors can access this more easily. And the novelty technology that we will be talking about is biosensing, microbubbles, and chirosurgery.
We decided to apply novelty technology towards cancer. Cancer is the uncontrolled division of abnormal cells in a certain part of the body, which can be attributed to errors in DNA repair genes, errors in the tumor suppressor genes, or mutation in proto-oncogenes. Cancer is commonly attributed to genetics, but can also occur from exposure to harmful chemicals, radiation, or UV rays. There are more than 100 types of cancer found all around the body, such as breast cancer, lung cancer, prostate cancer, and thyroid cancer. Around 39.6% of men and women will be diagnosed with cancer during their lifetime, and developing novelty technology can further advance diagnosis and treatment of cancer. Here we have a pie chart breaking down causes of cancer, and as you can clearly see, cancer does not develop from only one specific cause. The picture on the right explains how a cancer-affected cell divides rapidly to create an accumulation which leads to tumors.
So here's some statistics on cancer. In 2016, over 1.6 million people just in the US will be diagnosed with cancer, and over a third of them will die from the disease. Almost 40% of men and women will be diagnosed with cancer at some part of their life. This disease is so prevalent that there are 14 million new cases and 8.2 million cancer-related deaths worldwide in 2012. And about $125 billion were spent on cancer care in 2012 just in the United States.
Detecting cancer early on is extremely important to begin treatment in a timely manner. Current detection methods include a complete blood count, blood protein testing, tumor marker tests, a tumor-detecting CT scan, imaging done through radiology, and mammograms, which are specific to detecting breast cancer.
Some of the current treatments for cancer include chemotherapy, radiation, and surgery. So these are the three main types of cancer treatment going on right now. So chemotherapy works through the entire body to remove the cancer cells that may have spread, and it's a large dosage of drugs that are applied for multiple treatments that the patient has to attend. Radiation uses high energy particles to destroy or damage the cancer cells, and it's one of the most common cancer treatments. It's being able to use for multiple different types of cancer. And then surgery is one of the other three types of treatments for cancer, and it's just used to remove the tumor and observe how far it's spread.
Biosensing patches are small portable devices which can non-invasively relay specific information to the patient or doctor. These patches can be used to detect components found in sweat such as alcohol, glucose, sodium, potassium, calcium, or ammonium levels. Recent research has developed a way to connect the small portable electronic circuit board to a fashionable temporary tattoo. The tattoo releases chemicals to induce perspiration on the skin, which comes in contact with an electrode on the patch to detect concentrations of chemicals. This information is sent to a cell phone or computer to process via Bluetooth and can easily be retrieved by a patient or doctor. Here we have several pictures indicating what the small biosensory stick-on tattoos look like. So as you can see, they are completely non-invasive and can be easily hidden out of sight. The bottom right-hand image depicts the process if the biosensory patches were to detect alcohol levels. The concept of biosensing has much potential to be applied towards detection of cancer cells and tumors. Although the gap in literature is very large, novelty technology is constantly developed to address the needs and concerns of widespread issues such as cancer. The main barrier to cross in developing a biosensing tattoo for cancer is figuring out a way that one sensor can be tailored to so many different kinds of cancer. The potential of creating and marketing a device is definitely not out of reach and can save valuable time, money, and lives.
So microbubbles, the general composition is a gas core stabilized by a shell comprised of proteins, lipids, or polymers, and they're incredibly small and they're about the size of a red blood cell. Just the shell is 1 to 200 nanometers. And the different materials for the shell have their advantages over each other. For instance, one advantage of the lipid shell is that it was inspired by the unique qualities in nature. So the fact that it is biofriendly makes it a very useful idea for a microbubble in order for the body to accept it. And so when you have the microbubbles, you have to get them specifically to the target tissue. And so you use ultrasound radiation forces. And they're used to guide the microbubbles and then used at different strengths to contract and expand the bubble to let out the gas. Using microbubbles as a drug delivery tool in part is to improve accuracy of the drug action and decrease the side effects of the drug action in the healthy parts of the body. So research has been done to see how microbubbles could potentially increase the efficiency of cancer treatments. Cancer treatments are paired with microbubbles and injected at the same time, and this is called co-injections. The results of A experiment came out to be that the rats that were injected with the MIR1331 microbubbles with a lower frequency of ultrasound had a decrease in tumor size and a higher survival rates.
So cryosurgery is actually an old technology that is re-emerging. It originally started in England in the 1840s, and it lost interest when some of the new technologies were being created. It allows for less pain and a less invasive surgery, which allows for faster recovery time for cancer patients. And cryosurgery is actually being researched right now, and they're finding that the ability to treat different tumors and different tumor sizes depends on the size and temperature of the ice ball that is created to go around the tumor. And it's currently being used with skin cancer and warts, where they just freeze the cancer or the warts right off the skin. And it's being developed and researched in other cancers such as prostate cancer, breast cancer, and lung cancer in mice. And so here are some images of cryosurgery. On the left is an image of cryosurgery in the liver, and they've injected the needle into the liver and around the tumor, and they're creating this ice ball around the tumor so that once it starts to defrost, the body will actually be able to eat up the dead cancer cells. And the same image on the right is an image in breast cancer using ultrasound and the same sort of ice needle method. So overall, the importance of cancer and novelty medicine in biomedical engineering is very important, because without novelty technology and these wild ideas, engineers would not be able to expand their ideas and be willing to try new things. These wild ideas could hold the future for cancer medicine and allowing for patients to live cancer-free. And kind of tying it all together, all of our different research topics that we discovered, biosensing, microbubbles, and cryosurgery, they all have lots of potential in how we determine and diagnose the treatments of cancer in patients. And here are our references, and thank you, and Gigam.